It is mid-January 2025. Do you know where your Medicare reimbursements are? Buckle up, we're going to get into a new RCM Roundup. Hey guys, what's up? Tiffany Robinson here, aka Coach Tiff from Beyond RCM Revenue Cycle Management, ready to get into today's evolving topic because, listen, Linda, Medicare is out here doing the most and we need to talk about it. We need to talk about it. We need to prepare the people. We need to make sure our books are ready, our minds are ready. Like, we need to talk. But before I get into today's evolving topic, I want to welcome everyone to the channel. Beyond RCM is a YouTube channel designed to discuss all things related to healthcare. We're talking about healthcare topics in the news. We're talking about issues related to the profession from my colleagues in healthcare information technology, medical billing and coding. We're talking about administrative functions, business functions. We're talking about individuals who may not even be exposed to healthcare, learning about the field for the first time and why this is a field that is exploding, showing no signs of slowing down. And most importantly, my latest kick is talking about health and wellness, because healthcare is a very stressful industry and we need to make sure that we take care of ourselves. So if this is your first time hanging out with us, thank you so much for checking out the channel. But I want to encourage you to not only stop by this time, but to hit the like, subscribe, and notification bell so that every time we put out a new topic, you will be one of the first to know. All right, guys. So about Q3, Q4 of last year, Medicare announced that it was proposing changes to its fee schedule. And ultimately, they decided that they would lower their conversion factor by 2.83%. Now, of course, when everybody heard about this, providers were in a tizzy. The AMA was like, what are y'all doing? We're already struggling as it is to take care of patients and y'all about to chop us off at the knees even further. The people were not happy, okay? Many asked Medicare to rethink its decision, and Medicare ultimately still decided to bring down the conversion factor. So ultimately, what that means is that virtually almost every CPT code that is under the Medicare physician fee schedule was reduced as a result of Medicare lowering their conversion rate, okay? Now, in addition to that, we have another component that we have to contend with when we get to the final equation of what we're going to be paid for medical services. And that other item is our RVUs, our relative value units. And RVUs is a methodology that Medicare uses in addition to their conversion factor when they are assigning fees to a CPT code. Now, RVUs are built on three components. It's built on the physician work, it's built on the practice expenses or presumed practice expenses, because many practices will beg to differ, and it's built on malpractice, where if you live in a state like I live in New York, again, medical providers will beg to differ on how Medicare arrives to these numbers. But essentially, the RVUs are built on these three different components. Medicare mixes it into a pot and mixes it together and says, poof, here's the price we're going to pay you for your CPT codes. That's just my analogy of it, but I'm sure it's much more detailed than that. In any case, the reason it's important for us to have a conversation about the conversion factor and RVUs is because the conversion factor was reduced across the board, providers are going to see a baseline reduction across the board that will impact virtually every CPT code. But then on top of that, if Medicare decided to bring down the RVUs for their most frequently performed CPT codes, that can result in even lower reimbursement. So providers don't just have to worry about a 2.83% reduction, because many practices will say, oh, well, that's not too bad. I can stomach that. But if Medicare ultimately brought down the RVUs for your most frequently performed CPT codes, you need to pay attention to that. So I know sometimes I may have medical providers, which most providers don't really stay on top of this because, again, they're focused on treating patients. But I may also have practice managers who work in very busy offices and, they're doing the job of multiple people. So they don't have time to stalk Medicare with all of their updates. So if you work in a medical practice, if you work in the business office, even if you're not a practice manager, but you're someone just checking out the channel, please go into your office after you watch this video and check your Medicare reimbursement rates. I want you to do two things. I want you to go to your local Medicare administrator. So for me, I'm in New York, so my MAC is NGS Medicare. I want you to make a list of your 5 to 10 most frequently performed CPT codes in your practice. I want you to check what your reimbursement rates were on December 31st, 2024. And then I want you to check what your reimbursements are as of today in 2025. Now, if your reimbursements did not change at all, that is great. If your reimbursements went up, that's a bomb. But and bomb isn't good, not bomb isn't bad. But if your reimbursements went down, you need to alert your stakeholders at your office immediately, okay? Because guess what? This change, if your reimbursements went down, this change not only affects your Medicare reimbursement, but if you notice, or if you go and research further, if you have contracts with commercial payers, most of those contracts are based on the CMS methodology. For example, your contract with a company like Aetna or Blue Cross Blue Shield may say that for your services, you will be paid 80, 90, 95, 100% of the CMS fee schedule. So that means that as the CMS fee schedule goes down, so too does your insurance contract reimbursement go down, which will affect all of your service lines being provided by your medical practice where you are seeking reimbursement from the insurance company. So this is a very big deal, and I can see why many companies like the AMA came out very against this push, because over the years we have seen reimbursements systemically get cut for various reasons over the years, and medical providers have basically been screaming that they have had to learn how to do more with less, right? So definitely, please go back, check your rates, check all your contracts. If you're seeing significant changes, please alert all of your stakeholders and budget yourself appropriately. Now, one thing I really appreciate about this channel is we have a lot of patients that check out this channel, and they send me messages all the time about the fact that they're learning so much about insurance from watching the channel. So if you are a patient and you don't necessarily work in the provider's office and you are like, okay, Tiff, this is scary. Does this mean that I am going to have to pay more money out of pocket? How is this going to affect me? I just want to say that this is not going to necessarily affect patients in the short term, but there is a potential for patients to be dramatically affected in the long term. And I'm going to explain why. These rate changes that Medicare is implementing on medical providers cannot then take whatever money they're losing in reimbursement from Medicare and pass it on to the patient. That's not the way it works. Ultimately, they're going to have to figure out and budget themselves accordingly to be able to continue to keep their practices operating in a sustainable manner. As Medicare patients and Medicare recipients, you're still only required to cover your out-of-pocket costs. So that means your deductible at the start of the year. If you don't have a supplemental carrier that picks up that deductible for you, you would still be responsible for that. And then, of course, we know that Medicare only covers 80% of medical expenses. So again, if you don't have supplemental coverage, you would be responsible for that 20% difference. That is going to remain the same for patients in the short term. Where this can have a long-term effect on patient care is in the long term. Many studies have shown, and you'll even see here on YouTube, countless of medical providers are opting to stop practicing medicine altogether because they find that the work is just too labor intensive and they are just not making ends meet. So you find a lot of medical providers that are ditching the profession to explore other work opportunities. And as we have an aging population that is living longer, and we know, unfortunately, the older we get, the more we have health issues that we have to contend with. We are going to put a tremendous strain on the healthcare system as we have an aging population that continues to grow, and we have medical providers that are leaving the profession because they just do not find it to be feasible to continue practicing medicine and support themselves and their families. And this is why these systemic cuts that continue to happen year after year by Medicare and then other companies following suit, piggybacking off of Medicare's cuts, is problematic to the healthcare industry overall. So while it will not affect a patient in the near future, this is going to continue to create problems as providers continue to leave in droves. But definitely wanted to put this roundup out on this evolving topic because it is the start of the year. You are going to dramatically notice shifts in your reimbursements if your RVUs have been reduced by Medicare, and you are going to need to, budget yourself appropriately and budget your practices appropriately. I hope you found this information that I provided today very useful. If you did, please don't forget to give us a thumbs up, give us a like, drop us a comment. This helps our content continue to permeate the YouTube algorithm systems so that our information can get out to all those who find it useful. Thank you so much for taking the time to hang out with me today. My name is Tiffany Robinson, aka Coach Tiff. I enjoyed my time hanging out with you, and I will see you in the next roundup. Peace out. Bye.